Hi guys, welcome back to Toria's Crown. This is Victoria Owusu, a registered nurse. Thank you very much for hanging out again with me. Today, I wanted to talk about my personal experience during the NCLEX RN and the new format to come April 2023. So let's get started. I had my NCLEX review class in LaGuardia Welcome Back Center. So it was like a year, but basically like the program was like mostly 6 months. So after the preparation, I had already had my ATT, so I just went forward and took the NCLEX exams. I wanted to share some of the materials I used. I used ATI, which was provided by LaGuardia, and it was very good. It has a lot of questions for you to solve, a lot of materials that is very important in nursing. It has basically every system. After you read a system, it gives you a couple of questions to answer, and the answers are always at the back. They also have the online ones, which also help you to solve the questions as you are sitting in the NCLEX exams room. And I also use UWorld. So UWorld, I registered it for 3 months, and I used it like 1.5 months because my date was too close. So I didn't even have that much time to finish the whole 3 month period. It's mostly helpful too. It has a bunch of questions for you to answer, and it gives you detailed explanation to every answer, and why it's not A, why it's not B, why it's not C, why it is A, or why it's B. It gives you a detailed explanation, and it helps you learn more. That is UWorld for you. It gives you like similar sample questions that looks like the NCLEX. And I also used Sanders Comprehensive Review. That was my go-to. That was what I used throughout the 1 year preparation. I used it because we always go to class anyway. That's the book. That was the book we were using. It's very helpful. It has a lot of fundamentals of nursing. It has pharmacology. It has your organs. It has everything you need to pass your NCLEX in there. Mostly that was the book I used. I had a soft copy and I had the pamphlet. So when I'm going to class, I have my hard copy ready to go. And when I'm in the train, in the bus, I have my soft copy on my phone, reading it every now and then. So these were the three things I used, and it was really helpful. But you know what? Anxiety in exams is normal. It's normal part of us. So the day for my exams came, and I was so anxious. I took an Uber to Manhattan to take the test, and I was vomiting, very anxious. Like I had everything. I was shaky. But you know what? I just calmed myself down because I said it's part of the process. This is my first time taking it. It's not going to be easy. I'm going to go through it. But you know what? I'm just going to go for it. I went, and it was during the COVID time, so we have to do a bunch of cleaning, hand cleaning, and all those stuff. So we started the test, and I was the last person to leave the room. Everybody left, and I was the last person to leave the room. It was during the COVID, so it wasn't much questions as before. So I think it was 145 or 175 to 145 questions. And to be honest with you, I answered every single question. I had the whole 145 questions, and I had a bunch of multiple choice. I had some simple questions with complicated answers. I had some delegation questions, but I didn't have no click and drop or anything of that, or table or chat or anything of that sort. It wasn't pretty easy, but it wasn't really difficult. The thing is, I don't know what I'm answering. If I'm wrong or right, I don't know. I'm just sitting there answering a bunch of questions. That is nursing. That's all I can say. But you have to know your delegation. You have to know your prioritization. You have to know everything. You just have to get prepared, learn as much as you can, and don't wait a month, 2, 3, or 4 after you finish your nursing school trying to get prepared. just go for it. As you finish, immediately you finish your class, you graduate, get your ATT and go sit for it. The longer you take to test, the more the material gets difficult, or you forget some of them. So it's very helpful when you take it right away. It's not easy. Nobody said English is easy, but you just have to do your best. You have a lot of multiple choice. You have hot point. They'll give you a diagram to note which point is that, what is this. You have a whole bunch of things that you need to know. So just get prepared, study hard, never give up, and just go for it. So I also want to talk about some of the new things that is going to come on the NCLEX coming April 2023. They're saying they're going to change some of the formats. They're going to have extended multiple response. They're going to have extended drag and drop. They're going to have enhanced hot points, and all this is they're going to change the formats. So they're going to give you a multiple choice. At first it was like 4 of the multiple choice, like select all that apply, but now they're going to give you like 5, 6 or 7 of them for you to choose which one you think is part of the answers they are requesting for. But the good thing to that is they're considering if you partially get some right, you should get a point. So I think it should be fair if it's that way. And they're going to be doing extended drag and drop. So they're going to give you a bunch of options on the left side or the right side, and they're going to tell you to drop them to the left side, whichever matches depending on the question. And the new thing they're going to bring on board is fill in the blank, similar to that. So they're going to be asking you like nursing question, and they are going to ask you to fill in those spots they leave blank. To me, that is a little like difficult because a lot of things can fit in some of the spaces, but you know what, that is the thing that is coming on board. So we should as well get prepared. So coming April 2023, the format for the NCLEX is going to change. So don't forget to go to the website and just read more, know what you're going to sit for. But up till now, we're still going with the old format. Get prepared, study hard, and good luck to anybody who is preparing for their NCLEX. Don't give up. Hold on tight. Whatever material you're using, just stick to that material and learn very hard. Don't leave your class book, your books you took, the notes you took behind from school. Keep those in mind because you never know. And always go for good. Thank you very much for tuning in with me today. If you haven't already, like, share, comment, and subscribe. Thank you very much for hanging out today. Thank you. Bye.